Hi friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant in fetal medicine. So today we are going to talk about a new technique, right? So जैसे कि आपको पता ही है कि technological advancements are happening. So that is happening in the field of the prenatal diagnosis also. So many a times the premise of the fetal medicine is to identify whether my baby is doing absolutely good, both in the hardware terms as well as in the software, meaning thereby कि genetically भी baby मेरा स्वस्थ और तंदुरुस्त हो, right? सो कुछ एक केस आज अच्छा केस है मेरे पास में, तो मैं बता देता हूँ कि दैट हाउ वी हैव यूज दिस न्यू टेक्नोलॉजी एंड दैट टेक्निक एंड द न्यू टेक्निक हैज़ हेल्प्ड अस आउट, right? Had it been a case, we would have used the old traditional ways of doing the prenatal diagnosis, we would have missed this thing, right? So this is the fetus, ये primary gravida है and the fetus is under evaluation for a slightly increased nuchal translucency, right? तो तकरीबन 13 weeks का बेबी है और जो nuchal translucency वो 2.3 2.4 in that range. So this is the nuchal translucency. The basic evaluation of the baby is absolutely great. Ductus venosus normal है. We try to look around for the tricuspid regurgitation and so there is no pathological TR, right? And then we try to do all the assessment of the cardiac to the baby, which looked absolutely great. Nasal bone ठीक है, so we are not, this is the nuchal translucency, so we are not contemplating a Down syndrome baby. We did a CVS and then we identified this pathogenic mutation. Okay, nuchal translucency was not greater than 95th centile. It was 2.3 2.4, which was slightly mildly increased nuchal translucency. The first examination of the baby in all the contexts was absolutely normal. Nasal bone, cardiac, ductus, TR, gallbladder, kidney, bladder, urinary bladder, and the kidneys, they were absolutely great. Okay, but then we identified that since it is a mildly increased nuchal translucency, there could be some possibility in the tune of 1 to 2% that probably we might be having some microdeletions or microduplications or chromosomal aberration in the background, and therefore we had advised for a CVS and a further genetic analysis. Old traditional way of thinking was this, that probably we could have offered her a 750K microarray. Microarray is a chip based sort of an array जिसमें कि 750 मिलियन चिप्स फिश होती हैं या वो एरेज होते हैं, वो एक्चुअली फिश होती है which is widespread throughout the genome, and then we would have done that 750K array. अब उसमें इशू ये रहता है कि वो एरे जो है वो इट इज़ वेरिएबल विद द कंपनी फ्रॉम विच वी आर यूजिंग इट, एंड देयरफॉर स्टैंडर्डाइजेशन ऑफ दैट चिप्स और इज नॉट देयर. पहला. दूसरा ये है कि चूंकि वो फिश है और तो उसकी जो रेजोल्यूशन है वो तकरीबन 200 kbs या 500 kb डिलीशन तक ही रहती है. then this time what we did, we opted for a low pass genome sequencing. Now low pass genome sequencing is a new way of doing it, in which we are doing a sequencing, we are doing a NGS, and then we are doing a sequencing of the genomic DNA of the fetal DNA. So what we did is this, that we could identify a 10 kb complete deletion of that particular gene which is pathogenic and which is responsible for congenital cardiac defects, right? So had it been a case, we would have opted for a 750K traditional 750K array, we would have missed this thing, right? So that would have turned out to be normal, but the new technique which we called as, so there are different companies which are offering it, and but ultimately the technique is a low pass genome sequencing, which is a 5x genome sequencing, and then we identified sort of a 10 kb deletion involving a particular gene which is responsible for the congenital cardiac defects, right? So that is how there are few sort of in literature, few reports are also coming up in which they have picked up something 166 kb or 200 kb sort of in deletion, which would have been missed by a traditional thinking in a DMD gene, right, in a prenatal case. So this low pass genome sequencing probably has helped us out immensely in this prenatal diagnosis, right? Thank you very much for your patience.